It's inevitable that at some point in our lives we lose a little sleep. Approximately 70 million people in the United States are affected by a sleep problem, and an additional 20 to 30 million are affected by intermittent sleep. In this video, you'll learn the signs, symptoms, and treatment methods of some common sleep disorders. The amount of sleep a person needs depends on several factors. Infants generally require about 16 hours a day, while teenagers need about 9 hours on average. For most adults, it varies. In general, most adults need 7 to 8 hours a day.
Sleep has a very important role to play in the maintenance of connections between nerve cells, particularly those in your brain that are used to process information during the day.
Sleepers pass through 5 stages of sleep: non-rapid eye movement sleep, which has 4 stages, and rapid eye movement sleep, which is deep sleep, or the dreaming phase. A complete sleep cycle takes an average of 90 to 110 minutes. During REM, or deep sleep, a form of paralysis occurs. This prevents the body from manifesting movements made in the subject's dreams. Of all the sleep disorders, insomnia is the most common. Insomnia is characterized by the inability to fall asleep or stay asleep. There are 3 clearly defined types of insomnia: transient, acute, and chronic. Transient insomnia lasts from days to weeks. It can be caused by changes in sleep environment, timing of sleep, severe depression, or by stress. Its consequences are sleepiness and impaired psychomotor abilities. Acute insomnia is the inability to consistently sleep well for a period of between 3 weeks to 6 months. Chronic insomnia lasts for years at a time. Its effects can vary and are characterized by sleepiness, muscle fatigue, hallucinations, and/or mental fatigue. While the causes of insomnia are numerous, it is best to see a sleep specialist for diagnosis and treatment. Self-medicating with over-the-counter drugs may cause rebound insomnia. Insomnia is best treated by practicing what is called good sleep hygiene. This means you stick to a regular bedtime schedule. Get out of bed at the same time each morning, even if it's a weekend or holiday. Avoid naps during the day. Avoid stressful activities and vigorous exercise for 2 hours before going to bed. Make sure your bedroom is dark, quiet, and cool. Avoid substances that contain caffeine, and avoid alcohol and nicotine before bed. Another common sleep disorder is sleep apnea, which is characterized by repeated lapses in breathing throughout the sleep cycle.
The upper throat or upper airway, the tube through which you breathe that connects your mouth to your lungs, collapses during the night and results in the sleeping individual struggling to breathe against a collapsed or closed upper airway.
Symptoms of sleep apnea include, but are not limited to, waking up with a very sore or dry throat, occasionally waking up with a choking or gasping sensation, sleepiness during the day, morning headaches, forgetfulness, and mood changes. If these symptoms are persistent, it is recommended to see a sleep specialist for a complete diagnosis. Diagnosis is conducted in a sleep lab. On the night of your sleep study, you will be assigned to a private bedroom. Near the bedroom will be a central monitoring area where the technicians monitor sleeping patients. You will be fitted with surface electrodes on your face and scalp that will measure brain and muscle activity during the sleep process. Sleep apnea is treated using a continuous positive air pressure or CPAP machine. These devices, which are fitted to the individual patient, supply a steady stream of oxygen through the nostrils that help the person breathe uninterrupted through the night. Sleepwalking, night terrors, and rapid eye movement sleep behavior disorder, or RBD, are relatively rare, but can cause interruptions in sleep patterns. Each disorder is characterized by the phase of sleep in which they occur. Night terrors occur during a phase of deep non-REM sleep, usually within an hour after the subject goes to bed. Night terrors are common in children and normally do not affect adults, although there are instances. NTs are characterized by extreme terror and a temporary inability to regain full consciousness. The subject wakes abruptly, gasping, moaning, or screaming. It is often impossible to fully awaken the person, and after the episode, the subject normally settles back to sleep without waking. Night terrors are most commonly triggered by being overtired. If the night terrors are more frequent, however, it is suggested you wake the sufferer from sleep just before the time when the terrors occur to interrupt the sleep cycle, usually an hour after sleep onset. Sleepwalking is characterized by the ability to perform complex tasks while still asleep. Sleepwalking occurs at any age, but it occurs most often in children aged 6 to 12.
REM sleep is typically preceded by about 90 minutes of sleep after initial sleep onset, called non-rapid eye movement sleep. And that's where sleepwalking occurs. It occurs in that first phase of sleep during the night.
Subjects will often appear awake with a glassy-eyed look and can appear aware of and interact with their surroundings. An episode can be very brief or can last for 30 minutes or longer. Although sleepwalking has no long-term health effects, in the short term, subjects may be injured due to tripping and loss of balance. Another sleep disorder similar to sleepwalking, but far more dangerous, is called rapid eye movement sleep behavior disorder. In a person with REM sleep behavior disorder, or RBD, the paralysis that normally occurs during REM sleep is incomplete or absent, allowing the person to display behaviors that are occurring while they dream.
People will get up out of sleep and behave in response to their dream imagery, and can often find themselves in potentially injurious situations because they are behaving in response to an internal hallucination and not to the reality which surrounds them.
RBD is characterized by the acting out of dreams that are vivid, intense, and violent. Behaviors include talking, yelling, punching, kicking, sitting, jumping from bed, arm flailing, and grabbing. Injury can happen to the patient or to their bed partner. RBD usually happens later in life and is associated with degenerative neurological diseases such as dementia. RBD is treatable with the anticonvulsive drug clonazepam, which helps to suppress muscle activity. Over time, the effects of too little sleep can cause long-term health problems such as anxiety, depression, hypertension, heart disease, weight gain, diabetes, and a weakened immune system. For more information, log on to these helpful websites.